Should we be doing more to embrace hormone replacement therapy? I don't know the answer to that. I think this is a subject that needs more time for us to address. We obviously, as a culture, as an individual, we want to live as long as possible. We want to thrive. We want to feel great. But where it becomes a little bit challenging is to understand what is normal. What is normal for hormones? Your bodies were not meant to be 80 years old and functioning like you did when you were 20 years old. It's just not the case. And I'm bringing that up because I hear patients say, well, my hormone levels are low and they're, let's say, in their early 60s. How do we know that they're low? Who are we comparing that to? We didn't even test these things 100 years ago. So what are we comparing it to? People weren't living as long as they are now. So even if we were testing it at all 120 years ago, we would have only been testing hormone levels on people that were in their 40s and 50s, some in their 60s maybe, but certainly we wouldn't have a large population to test from because it was crazy for people to live longer or live a long time. People are living longer now. Actually, they're not living as long now as they were 4 or 5 years ago. The life expectancy in the United States has decreased every year for the last 5 years. The only time that's ever happened in the United States, by the way, is during World War I and the Spanish flu. Back then, people were getting shot at and killed, and you had a worldwide flu pandemic. And in our country, because of our diet, nutrition, and sedentary lifestyle, life expectancy has gone down 5 years in a row. But bottom line is, we don't know what normal levels of estrogen and testosterone and progesterone are for people as they get older, when they're getting into their 50s and 60s and 70s and even 80s. We don't know what those numbers should be like. So how do we know what normal is? Anyway, we do hormone therapy here when it's necessary. We also work very, very hard not to hormone replacement, which means we're looking at all the underlying reasons why somebody may not have optimum hormone function or expression or production. And we work very hard at enhancing that before we would opt to go for a bioidentical hormone replacement or something along those lines. Just how the body works in the feedback loops, we want to try to make sure that the body's doing its job properly before we add anything else to it. But other than that, we are, as a clinic, a fan of bioidentical hormone replacements when it's necessary. Anyway, I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional metabolic medicine, here to get people well without the use of drugs and surgery. Leave me some comments below. Let me know what you think about hormone replacement therapy, and hit the share button, and most importantly, hit the follow button. Thanks a lot.